right. It is 3:59. I want to go ahead and get started from the standpoint of, I know that I'm going to record the session, especially for our colleagues that are going to join us asynchronously. We're going to place all of our recordings for our Aspire workshops for these research skill development workshops for medical education research. We're placing them on our Aspire website, which will be opened up pretty soon. We're just ironing out some of the access points on our website, and all of our materials, our sample slides, and these activities will be placed on that website as well. It'll be open to our COSM community as well as our ARMC clinical partners. So that way, if there's any of these materials that you'd like, especially when you're developing your research protocols, your proposals, or even your IRB applications, that you can have some of these notes and some of the samples and examples that we've supplied for you. But we'll open up that website after ironing out a couple more of our access points for them. I want to go ahead and start off with some of our elements here. Let me just make sure I have my laser pointer here activated. Go backwards just a little bit. We'll be talking a lot about research-specific aims and research objectives today. And some of the elements will be divided up in two parts. The first part, we'll look at specific aims. And the second part, we'll look at research objectives. So you'll notice here that there are several learning objectives for today's workshop structure. It'll be divided into two parts. We'll look at specific aims in terms of its structure. We'll also describe some common challenges and solution to those challenges of writing specific aims. And then we'll perform some specific activities and just get a little bit of practice of specific aim writing. If you have specific aims, or those statements that you're working on, please list them in the chat. If you have questions about those items, please list them in the chat. I really want to be a resource for you, especially if you have specific questions about writing these particular statements. In terms of the second part, we'll use the last half of today's time, again, to talk about the SMART structure of writing objective statements. And I'm not talking about SMART, the word, not in terms of intelligence or intellectualism. I'm talking about the acronym SMART. We'll talk about how that helps us write very specific and very measurable objective statements. We'll also describe some specific aims and how they align to these objectives. And it's really not rocket science. It has a very nice linear flow of why we're talking about specific aims first, and how research objectives, those statements, really parallel and push forward those specific aim statements. And then we'll perform a couple of writing activities, not too difficult, but we'll get some practice in writing some of these research objective statements as we push through the second part. I'm looking at the chat every now and then, and I do see, thank you, Dr. Mosen, for joining as well in virtual land. Yes, please do not look at any of these slides while you're driving. I know that you're in the car and in transit, but please, I'm hoping you'll treat this like a podcast, and then you'll hear some of the oratory about specific aim statement writing, as well as research objective statement writing as well. We'll just jump right in, part one, as part of our two-part discussion. In terms of specific aims, these particular statements really are driven by what our research question is. And as you recall, our first session of our workshop series for research skills development was about the research question. And it's really in terms of determining what our research question is, and that will determine where we're going to push and what direction we're going to go in terms of where our research project will go. The specific aim, however, helps us actually perform tasks in order to collect data or collect information to help us answer our research question. So the specific aims are a logical progression of, after writing your research question or your hypothesis statement, our specific aims will help us answer the research question. And what it really is composed of, the specific aim is a broad, overarching statement that describes what your research intends to accomplish. So really, this is the goal of your research project. This statement or set of statements represented by your specific aims are really the goals of your research project. What do you intend to accomplish? They provide the foundation for the research proposal or the research protocol and guides all of your methodological decisions and methodological activities. The specific aim statement is broad and focused at the same time. Broad enough that it encompasses the entirety of your research project, but it's focused on the activities that you intend to accomplish in your research project. It's comprehensive, but also manageable. It's broad enough, but not too broad that your research project becomes undoable. The other element here that relates to is that your specific aim statements are feasible. That when you write this statement, it's directing activities that you can definitely accomplish. They're achievable and they're feasible. They're within reason that you can conduct these activities in a reasonable amount of time in order to help you answer your research question. The other element here is that your specific aim statements are connected to what you've discovered in terms of your literature review and the gaps that you've identified. That they're connected to your research question, and there's a logical association between the questions you're trying to answer and the activities that you want to perform. The other element here is that your specific aim statements, they're action oriented, meaning that they're going to ask you to perform activities. They're going to ask you to perform some actions, whether that be data collection, assessment activities, evaluation activities, or simply identification activities. They're action oriented and they're performance-based statements. The other element here is that they're significant. They address the important questions that need to be asked. They're not menial tasks. The specific aims focus on significant progression or significant activities that help you push your project forward. Now, in terms of these functions in research proposals, because you've written specific aims that are focused yet broadly covering your research project, they're feasible, they're measurable, they're connected to the gaps in the literature that you've been examining, they're action-based, they're asking you to perform activities, and they're asking you to perform activities in a substantial way. It helps you guide your methodology and the methods you choose to gather data. And they also provide scope and boundaries because that they are broad and focused and they're statements of feasibility and viability in your research activities. They provide scope and they also give you boundaries so that you're not going into the nebulous void of what research activities can entail. And they also identify resources that you'll need and have to procure. Because they're action-based and activity-based, there's certain resources that you need. For example, different types of survey instrumentation, different types of personnel, whether you need a biostatistician or a qualitative researcher with their expertise, it justifies the different types of resources, whether instrumentation, funding resources, or even personnel resources. It helps you identify those and collect those pieces of resources. Next, they provide evaluation criteria. Depending on the data that you collect based on the items that you've identified in your specific aims, it provides evaluation criteria and assessment and data collection opportunities. It also allows you to communicate your research vision to the funders. Often funders will in their project guidelines or application guidelines, they'll ask you specifically your specific aims and your research objectives. Very few funding agencies and funding applications will neglect this topic. They want to know specifically what your research goals are and what specifically your research activities are. And that's really rooted in and identified in your specific aim statements. Any questions so far? If you have questions, please ask in the chat. And in the chat, I'll hopefully type in some of those responses and also verbalize them on our microphone here. In terms of specific aims and the structure and essential components, I've listed three main components here for the specific aim statements. And in the first one, they're really relating to the previous slide that these are action-based statements. These statements are not asking simply for descriptive information. They're asking for some type of activity or performing some type of duty or responsibility in terms of action. And you'll see here that these are very common, strong verbs, action verbs that appear typically in specific aim statements. And every one of these are statements or words that you've used, especially if you've created a proposal in the past or designed a speaking session or a presentation. These are actionable words. Determine, evaluate, assess, compare, develop, test, examine. These are all action words and strong verbiage in order to for you as a researcher to collect information or to evaluate information or to evaluate data. You'll notice that these words are not passive. They're actually directing the type of action that you should be targeting. For example, the more popular words here are evaluate, assess, develop. You'll even hear words such as identify, contrast, etc. The second element here for our structure and our components of specific games is that there is a research focus that identifies what you're studying. You're not only picking the strong verb and action and activity that you want to direct, but you're also identifying a specific element that you're interested in that you want to investigate further or study. They could be intervention effects. You perform an intervention, a therapy, or a treatment, and you want to record the data as it's represented by the effects of that intervention or the effects of that therapy. There's also elements of relationships between two things or several things, relationships between variables, or even associations between two different elements or two or more different elements. But we're looking at relationships or associations between different items. We also use specific aims to help us identify the effectiveness of different therapies, interventions, or approaches. And sometimes we identify elements like factors or risk factors that influence particular outcomes of interest. The third element here is that there's typically a population or a group. In our case, especially when we're working with human subjects, human participants, there's a sample of individuals that we're interested in with very specific criteria and characteristics. There's a population and a context related to those people and individuals we're hoping to investigate or research further. We want to identify who and where they are. That includes a target population or a target sample, the setting in which they live or exist, and the context in which they live or exist in. And there's also inclusion criteria. We're looking for very specific characteristics of where these individuals reside or they work or that they are studying in. And we also tend to give a geographic scope or a geographic indication of where these individuals are located. You'll see here in this example, I've color-coded each of these elements, the action verb, the research focus, the study population, as well as the expected outcome that's being measured. I color-coded each of these elements. For the action verb, it's colored in yellow, research focus is going to be colored in green, and so on. I'll read the statement, and then you can piece these items together, especially for all of you who are joining us in our virtual environment. Determine the effectiveness of simulation-based training compared to traditional clinical rotations on improving clinical decision-making skills among third-year medical students. Our action verb here is that we're determining something. We're trying to find a finality to measuring some type of outcome. The research focus here is effectiveness of simulation-based training compared to a traditional model of teaching. Our study population here is noted in blue. We're looking specifically at medical students who happen to be in their third year. And our expected outcome here is clinical decision-making skills. Clinical decision-making skills, and more specifically, whether or not those skills improve after being exposed to a simulation-based training program compared to a traditional training-based program. Are there any questions on this? And you'll note here that these specific game statements, they're not short statements. Because they include these elements, an action or activity, a research focus, they identify a study population, and even identify an outcome, they're actually very lengthy statements depending on the complexity of your research project or the complexity of those activities. Questions so far? I'll pause here to take a look at the chat. All right, we're doing okay. We'll move on. Here's our first activity. Here's our first activity, specific game writing practice. And we'll look at this formula, if you will. This formula, it's not a mathematical formula, but it is a formula nonetheless. The instructions are using the scenarios below, which will appear on these next animations. Write a specific game statement for each research idea that you'll see that will be listed momentarily. Follow the formula. There's typically an action verb or an action word or statement. There's usually a research focus, a study population that you've identified, and an expected outcome. Our first scenario is scenario 1 of a research activity where you want to study whether mindfulness training helps reduce burnout in resident physicians working in emergency departments. You want to study whether mindfulness training helps reduce burnout in resident physicians working in emergency departments. Most of your work is already completed here because we've identified a gap, and our gap is looking at mindfulness training. The outcome is burnout in a specific population of resident physicians, and they're working in a specific geographic or location in the emergency department. We can get more specific at ARMC or Loma Linda University Medical Center or Kaiser Permanente Fontana. We can get even more specific if we wanted to stick to specific examples and geographic locations in the Inland Empire. Go ahead and take a stab at this. Type your response in your chat. I will type my response as well. Type your response in the chat and we'll see what some suggestions are. Take a couple seconds, so don't mind the silence, because I know you're eager to share your suggestions here. Any takers? Anyone want to take a stab at this element? A couple more seconds. I'll take the first stab. There are no takers. Let's try this one. Go ahead and take a look at your chat box here. One of our specific aim statements, and I'll read it out for the group here. One of our specific aim statements, and you'll see it in the chat. Identify, there's our action verb, identify specific strategies in mindfulness training that reduces burnout among resident physicians who work in emergency departments. So you'll note here, our action verb simply needed to be added to this gap in the literature or this research focus or this research question. We want to identify specific strategies in mindfulness training that reduces burnout among resident physicians working in the emergency department. And we can even pick any specific geographic location or facility in the Inland Empire if we choose to do so. Let's look at the next one. Here's our second scenario. You're interested in investigating how virtual reality simulations affect airway intubation for medical student training compared to traditional didactic training. You're interested in this particular field of clinical training in investigating how virtual reality simulations affect airway intubation for medical student training compared to traditional didactic training. Let's go ahead and take a couple seconds here. You can type these up into the chat or write them down for those of you that are in virtual land. And I'll go ahead and put in my response in a second. Again, taking a look at the second scenario, we want to start off with an activity or action-based term or verb. Because we're looking at medical education and training of medical students, we can actually write an actionable verb such as assess how virtual reality simulations affect airway intubation for medical student training compared to traditional didactic training. Here, the actionable word is assess. Assess the virtual reality simulations, how they affect airway intubation for medical students compared to traditional didactic training. Let's look at yes, go ahead.
Um, can you make it a bit briefer and avoid that? I mean, can I, for the first one, say, does mindfulness training help reduce burnout in resident physicians, etc.? Just go straight to does. And in the second scenario, does virtual reality simulation training affect airway intubation? So can one do that?
The question is, can we make this more concise and focus in on the actual activity, and we don't focus on certain elements like location? If we take a step backwards in that
You
direction,
could mention location, but instead of saying investigating or study, make it just does.
yes, if we use that verbiage and we say we investigate mindfulness training, it actually reverts back to what our research question is, because our research question typically is a bit broader because we're interested in a gap. But what the specific game does, it focuses that gap a little bit more. So now we're focusing in on a specific population or a specific environment. So now we're focused on collecting data that's now feasible because we've pared down the different possibilities of data. So it really is examining what's the feasibility of these activities, and feasibility depends on, well, what scope are we looking at? If we take a step back and look at words and use words like investigate mindfulness training in resident physicians, that's a large research field. Although it's an interesting gap, we need to narrow it more to help us focus our research activities. Very, very good question. Excellent question. We'll hit our last scenario here. Number 3 is you want to explore factors that influence medical students' choice of primary care specialties in diverse communities. You want to explore factors that influence medical students' choice of primary care specialties in diverse communities. Take a couple seconds here, type those up on for those of you in virtual land, or write them down. Take a couple seconds. I'll enter my suggestion here into the chat box. Here you'll note the operator or action verb here is evaluation. Evaluate the factors that influence medical students' choice of primary care specialties in diverse communities. Evaluating medical students' choices. Here the action is we're trying to gather data so we can evaluate it relative to what their choices are in primary care specialties. You'll note in every one of these examples, we've gotten a little bit more specific. We've listed an action verb, there's a research focus here, a specific study population or study sample, and an expected outcome. Let's keep going. Something that I recommend to all of our researchers and those of you working on research projects is don't do this in isolation. Don't do this in isolation. Practice writing your specific aims, especially for those of you who are writing research proposals towards extramural funding and grants, because I think a second, third, maybe fourth pair of eyes, because you're so close to the writing, so close to the project, that you'll need an outside person's perspective of does your specific aims or even your research question, do your specific aims make sense? Are they feasible? Are they too broad? Do they need more specificity? Share your aim statements with a partner or a trusted colleague and check and ask these questions. Is it clear what you plan to do? And is it feasible? Because if it's not feasible, then how can you complete it in the scope of the research project? Funders will likely not fund a non-feasible idea or non-feasible activity. And is it significant? Are you performing activities that will likely produce substantial results? If they don't, or if there's a hint that they're too vague or a hint that the data that you're about to collect is not going to contribute in a significant way, it will likely not get funded as a statement or a set of statements where those items are identified. So run it by a trusted colleague or someone that has expertise in those areas or expertise in writing specific aim statements. So when to use multiple aims? You will likely use multiple specific aim statements when the research question is complex. Complex or sophisticated or has multiple layers that you'd like to investigate. It requires different approaches or requires different types of data collection approaches. Also, if they're sequential studies, typically research can be broken off in phases, first phase, second phase, third phase, etc. Some of you are even working on research projects that are pilot projects, smaller versions of a larger project, and you expect to complete the pilot phase first and then the main phase after. So you might have a sequential research project where something has to happen first before another part gets initiated. So where one project builds on another. Also, there might be different populations. This is particularly true with pilot projects. Simply, you want to start with one sample population and then get larger in the next phase and work with a larger population or different populations. So populations may change or get larger, or settings may change, or settings might expand. And again, multi-phase projects with distinct components, having different specific aims or multiple specific aims might be warranted. You want to avoid multiple specific aims where the aims are essentially the same study or you're measuring similar events. You don't want to be redundant. You want to make sure your specific aims are standalone, but also are unique and independent. Resources are insufficient for the multiple studies. This goes back to feasibility. Because your specific aim statements are specific, they're focused. That will hopefully target how you're going to answer your research question. It'll give you an idea of the resources that you'll need. You'll be able to quickly identify if resources are available or resources are not available. And timeline does not support your specific aims. Your specific aims statements, because they're specific and whether or not they're feasible or not, it'll tell you if you have the time or within a certain timeline, you can get those activities completed. And if your specific aims are not logically connected, they're too independent, they're going off in too many different directions, you want to avoid having multiple specific aim statements. Keep it simple. Maybe one or two specific aim statements will be more suitable. Questions from the audience? I'm looking at the chat. Looks like we're doing okay. In terms of connecting specific aim statements in your writing, well-connected multiple aims can occur, just like we noticed in our previous slide. Here you'll see an example of specific aim statements that are not necessarily independent in terms of the activities that they are suggesting, but you'll see a connection between each of these three specific aim statements. Aim 1, assess current levels of empathy and communication skills among medical students at different stages of training. And aim 2, develop and pilot test the communication skills intervention based on the findings from aim 1. And if you recall from aim 1, we're assessing current levels of empathy and communication skills among medical students. And aim 2, develop and pilot test the communication skills intervention with those students. Aim 3, evaluate the effectiveness of the intervention on improving patient-provider communication. So aim 1 is develop and pilot test the communication skills intervention, and aim 3 is evaluate the effectiveness of that intervention. Notice the common thread here is communication skills training with medical students. We're going to develop and pilot test that communication skills intervention, and then we're going to evaluate the effectiveness of that intervention. The common thread is medical student training and communication skills. We're going to develop, pilot test, and eventually evaluate that intervention. Logical connection, where we don't have to repeat all of these elements because they're all connected, dealing with the same population, the same research focus, and particular and differences in the particular outcomes of each of the specific aim statements. Questions so far? You'll note here, I summarize that here, the connection logic. Each aim builds on the previous one, creating a logical progression and noticing the association between each aim statement with each other. And again, I repeat here, from the example above, the population outcomes do not need to be repeated, although the activities in each specific aim statement, they're different. Isn't that beautiful? Beautiful. Here's our second activity for the day. Connecting specific aims activities. Here's our instructions. Design a two-aim study. We'll focus on a two-aim study that addresses the research problem below. Each specific aim should build logically on the previous aim. Use this formula when you're writing your aim statements. An action verb, research focus, study population, and expected outcome. Here's our first problem or problem statement. Medical students struggle with clinical reasoning skills, and current teaching methods may not be optimally preparing them for real-world diagnostic challenges. There is a need to understand current deficits and develop more effective teaching approaches. What's a good specific aim statement here? If you want to take a couple seconds, go ahead and attempt to type up or write out a specific aim statement. I'm going to go ahead and type up mine and provide it in the chat box. Take a couple seconds here. Again, your problem is, and the situation that you are trying to write a specific aim statement for. Medical students struggle with clinical reasoning skills, and current teaching methods may not be optimally preparing them for real-world diagnostic challenges. Go ahead and I'll enter my suggestion here in the chat box. Identify the current teaching methods that provide clinical reasoning skills training that prepares medical students for real-world diagnostic challenges. Here, the operator is identify the current teaching methods. So we're identifying those methods that provide clinical reasoning skills training. That's our research focus, clinical reasoning skills training that prepares medical students, there's our population, prepares medical students for real-world diagnostic challenges. Let's go ahead and take a look at our second scenario here. The second aim that we can identify, I'm going to go ahead and put that in the chat box. Sorry, I promised, I thought there were two scenarios, but I gave you one scenario and I want you to write two specific aims. My apologies. Make that clarification here. I'm going to type that second specific aim here. Go ahead and take a look at your chat box. The second aim that we can write is based on the identified clinical reasoning skills. Based on those identified clinical reasoning skills, develop new and improved clinical reasoning teaching strategies that prepares medical students for real-world diagnostic challenges. So our operating action verb here is develop new and improved clinical reasoning teaching strategies that prepares medical students for real-world diagnostic challenges. We can even go a step further and write a third specific aims. How do we know that these new strategies are effective? Well, we can write a new specific aim is measure the effectiveness of these improved clinical reasoning teaching strategies. Measure the effectiveness could be our operating action verbs there. The take-home message I want you to derive from this slide is, what is the rationale for connecting these aims? Explain how the three aims, or actually two aims in this case, explain how the two aims connect and build on each other. They're all centering around this idea of identifying clinical reasoning skill strategies in a specific population of medical students towards real-world diagnostic application. With some practice on these specific aim statements, common challenges and how to avoid them are good strategies when you're approaching an opportunity to write specific aim statements. Some common mistakes is that these statements are too vague. Remember, specific aim statements direct where your research is going to go by giving very specific activities and action-based activities that you can perform. Sometimes they're too ambitious and they get too large. Using words like revolutionize or to measure every outcome, they're too big, and within the timelines that those types of ambitions imply, You probably don't have that much time to revolutionize a particular practice or measure data from all patients, etc. But using words like revolutionize medical education worldwide by developing the ultimate teaching platform, it's unrealistic, especially when timeline is involved. Also, methods are mentioned in your specific aims. You want to use methods that you can actually conduct. Being too aggressive in the methodology makes the feasibility of those activities less likely. So use surveys and interviews to determine. The problem here is aims should focus on what and not how. Some better versions of how to avoid these common mistakes is just be specific and clear. And when you're specific and clear on those statements, it makes that much more, gives you that much more opportunities for success for accomplishing those activities. Evaluate the effectiveness of case-based learning on clinical reasoning skills among second-year medical students. It's very specific, it's clear, and it's not too large of a task to complete. Make sure it's realistic and not too ambitious. Develop and pilot test a mobile app for anatomy learning in one medical school setting. Develop and pilot test. It keeps it within scope and manageable in terms of the activity that you want to perform. And focus on outcomes. Make sure your outcomes are feasible, again, and able to be collected. Determine the factors associated with medical student career choice decisions in primary care. Determine the factors associated with medical student career choices or choice decisions in primary care. Keep those outcomes measurable, and that if they're measurable, they'll likely be feasible. The take-home message on this slide is, again, when you write your statements, make sure that you share them with a trusted colleague or peer of yours that's an expert or has experience writing specific aim statements, whether it's for a research protocol or even a proposal for a funding opportunity. Share your aims with a partner or a peer and check, is it clear what they want to do? Is it feasible and is it substantial? Is it significant that will help you conduct your research and add to the existing research foundations that is out there? Questions so far? We have just a couple slides here on transitioning from aims to objectives. They are not the same thing, believe it or not. Specific aim statements are very different from research objectives, but there is a relationship that I want you to identify here. And that relationship is that the specific aims tell us what we want to accomplish. It's really the big picture of our research projects. But that big picture from our previous set of slides in part one, they've identified certain elements. And those certain elements obviously are an activity, the population, the outcome, and a research activity that we want to accomplish. For research objectives, they actually tell us how we will measure our success in accomplishing those specific aim statements. So these are actually statements dealing with the specific steps in accomplishing our research goals. Typically, the formula for a quantity of objective statements, if you have one specific aim, you should be able to write 2, maybe 3 research objectives for you to accomplish that specific aim statement. So I want you to think about your specific aim as being the overall goal that you want to target. Or in this case, evaluate the effectiveness of simulation-based training on clinical decision-making skills among medical students. In order for us to accomplish this goal of evaluating the effectiveness of this training in medical students, we have these objectives or research objectives that list the specific activities or tasks for us to accomplish this specific aim statement. Our first objective is, well, we want to compare pre-post clinical reasoning test scores. Number 2, we want to measure diagnostic accuracy in simulated cases. And number 3, assess student confidence in clinical decision making. You'll notice in every one of these objective statements, they're highly specific. There's a specific activity that we are about to perform. Compare pre-post clinical tests. We want to measure diagnostic accuracy in simulated cases. Number 3, we want to assess student confidence in clinical decision making. These are highly specific activities that drive data, that will produce data of some kind. Then you'll notice, going back to our specific aim statement, it's a little bit more broad than those 3 individual objective statements, evaluating the effectiveness of simulation-based training. But notice, every one of these objective statements can help us determine if we've reached this goal of evaluating effectiveness of simulation-based training in this particular population. Isn't that beautiful? That's wonderful. Excuse me. In order for us to write clear, focused, and measurable objective statements, we'll use the SMART, S-M-A-R-T formula. The SMART formula here, or SMART paradigm for objective writing, it's a framework, and there's specific criteria for research objective writing. S, for your statements, they should be specific. They should be clearly defined and using precise language. I give you an example here. Measure changes in diagnostic accuracy versus improved clinical skills. You'll notice the first statement here, measure changes in diagnostic accuracy, is more specific than improved clinical skills. M, measurable. This can be a quantifiable or quantified element and assessed objectively. For example, increase test scores by 15%. A poor alternative would be improve understanding. We can never measure understanding because we don't know the degree of which one person can understand something versus another person understanding something. You'll notice here, we can definitely measure test scores if they increase or decrease by a certain percentage. Definitely objectively measured. A, achievable. Realistic given their resources and constraints. An example would be you want to study 100 students. That's a good example. We can do that in a CUSM. One cohort here is 130 students. We can attempt to study 100 students in one cohort versus 10,000 students. Feasibility, we could probably do that if we had a lot of time, resources, personnel to get in contact with the 10,000 students. But that's not feasible, particularly because we are limited in resources and time. R, relevant, directly related to your specific aim. Make it directly related to your specific aim. An example would be measuring clinical skills for a clinical training study. Make it relevant. We're measuring clinical skills for a clinical training study. A poor example would be measuring diagnostic skills in a laboratory training facility. There are two different elements there. There are two different environments. Make it time sensitive and considering time as a factor. Make it time bound. Has a clear timeline for completion. Assessed at 6 months post-intervention rather than assessed in 36 months at post-intervention. One is within a reasonable amount of time. The other example is taking too much time. Using the SMART framework or the SMART criteria, you should be able to address each one of these elements: specificity, measurable, making them achievable, making them relevant, and making them consider time. You should have a very strong research objective statement. There are different types of research objectives here. I give you the three different types. There are probably other types out there, but we just don't have the time in this workshop to go over all of them. I want to make a statement here of your primary objective for your research objective. Make your primary objective your highest priority objective, your highest priority activity that you want to accomplish. These are your main, they focus on your main research questions, and they're the most important outcomes. If you walk away with nothing else accomplished in your research project, make sure that the thing that you accomplish is your primary objective. Second, you can have secondary objectives. You can even have tertiary objectives, but these are not your primaries. You would be happy and very pleased if you got information that was resulting from your primary objective being accomplished. Your secondary objective is exactly that. It's your second priority. It's important, but not as important as your first one. Supporting research questions can be included here. They can provide additional insights. They can explore other mechanisms that you want to investigate, and they can also support your interpretation, especially on data that helps you answer your research question. But these are not the primary objectives. These are the objectives. If you get your primary objectives answered or completed, the secondary ones are next. You can also have exploratory objectives here. Here, they can generate future hypotheses or future questions. They're exploratory for a reason. And if you have time and if you have resources, include those in there. But I would only caution you, focus on primary objectives as your priority, then look at your secondary objectives. And if you have time and resources, maybe include exploratory objectives as well. If your grant or your research proposal is quite large, you might get to use an opportunity to write primary objectives, secondary objectives, and even some exploratory objectives as well. The hierarchy tip here is limit yourself to one or two primary objectives, one or two secondary objectives, and maybe one or two exploratory objectives. You don't want to have tons and tons of objective statements because you may not, it may not be feasible for you to complete all of those particular activities. So here, as a formula, if you will, writing effective objective statements. Again, I'll give you a formula. There's typically an action verb. What will be measured? In whom? When will it happen? And the expected direction if it's hypothesis driven. Do you expect an increase or a decrease? Do you expect more or do you expect less? There's a direction of an outcome being identified here. Some measurement verbs could be measure, assess, evaluate, quantify, calculate. Again, notice here that there's measurement elements. There's also comparison elements and comparison verbs: compare, contrast, examine differences, analyze variations. You can even have relationship operators or relationship verbs: correlate, associate, identify relationships, determine predictors. These action verbs, you'll notice, they are all actionable and they're highly specific. A weak objective will use words such as look. I laugh at that because I don't think I've ever read an objective of some recent research projects that use verbiage like look at how students feel about their curriculum. They'll typically use verbiage like measure, assess, evaluate, or compare how different medical students in different cohorts feel about the new curriculum, or correlate the differences between the different levels of students about how they feel about the new curriculum. We very rarely see words like look or see. um, these are very weak objectives. They're not giving you enough direction in the activities that you should be performing. Strong objective statements, they're very actionable. Measure student satisfaction scores using a validated 5-point Likert scale survey administered to first-year medical students at 6 months post-curriculum implementation. Wow, that's a mouthful. But it has every one of these elements: actions, what will be measured, in whom, when, expected direction of a hypothesized question. You'll notice here that a strong objective typically is highly specific, but also has a lot of text compared to a weaker objective here. Less specific and less action oriented. Here's our activity. Smart objective practice. Our instructions are to transform the following weak objectives into smart objectives and consider what needs to be measured, how, and when. Weak objective: see if telemedicine works for medical education. See if telemedicine works for medical education. Here's a checkoff list. Is it specific, measurable, achievable, relevant, and time bound? Let's write our responses here. Take a couple seconds. I'll give you my stab at this activity for this response. The weaker objective states, see if telemedicine works for medical education. Go ahead and type this in here. Measure the effectiveness of telemedicine utilization among IE community members using a self-administered, supposed to be survey, self-administered, wrote so fast, self-administered survey among adult IE community members during the next 6 months. It is specific, it's measurable, it is achievable within 6 months, it is relevant to the research question involved dealing with telemedicine amongst IE community members utilization, and it is time bound. Here's our second example. Objective 2, study student stress in medical school. Study student stress in medical school. Take a couple seconds. I want to take a stab at this. Study student stress in medical school. How can we make a SMART objective using those criteria: specific, measurable, achievable, relevant, and time-bound? An example could be identify the factors that are associated with medical student stress using personal interviews with medical students during the first semester of didactic education. Identify factors that are associated with medical student stress using personal interviews with medical students during their first semester of didactic education. It is specific, it is measurable, it is achievable within a first semester of education. It's relevant to the medical student stress, and it is time bound within that first semester of didactic education. Align your objectives with your study design. For quantitative objectives, it's best for randomized control trials, cohort studies, cross-sectional surveys. Really, quantitative objectives, particularly when quantitative data is what you're searching for. It can also be used for qualitative objectives. It's really great for very specific information regarding interviews, personal interviews, focus groups, ethnography. You can, because it's involved in both quantitative as well as qualitative research, you can even use it in mixed methods research where you have a quantitative element in which you're collecting quantitative data as well as qualitative data where the data is from interviews or focus groups. Remember, in terms of alignment, your objectives must match your methodology. Don't write quantitative objectives if you're planning a qualitative research study or qualitative data collection. Your objectives for your quantitative study should reflect quantitative methodology. Your objectives for qualitative methods, qualitative objectives should reflect your qualitative methodologies. And that goes along with mixed methods. The quantitative objectives should align with quantitative methodologies. Qualitative objectives should align with qualitative methodologies. They don't necessarily intersect or cross. Questions on that? Here's some quality checks as well. And again, I always recommend this, especially when you're writing specific aim statements and now research objectives. Run them by a colleague, a trusted peer who has expertise in proposal or research protocol writing, or to get another pair of eyes to make sure that you're writing these objectives in very specific ways. So for specific aims, make them clear using action verbs, activity-based statements. Define study population, make them feasible. They address an important research gap that you've already examined through literature review and based a research question on. And multiple aims are fine as long as they're connected in some way and they're aligned with your research question. For your objectives, use the SMART criteria, SMART. Clearly state measurable, clearly stated measurable outcomes. This is supposed to be measurable here. And make sure that your objectives, your research objectives, are aligned with your study design, whether it's quantitative or qualitative research design. And make sure that if you're listing primary objectives, make that your highest priority objective that you want to definitely accomplish. And then you can write some secondary objectives as well. But your primary ones are the ones that you want to highly prioritize. And then make sure it's realistic and feasible. Your timeline should help you determine if the data collection based on your research objectives, they should tell you whether or not you can collect that data in a reasonable timeline and if it's feasible for you to do so. All right, are there any questions? Looking at the chat here. That's all the slides that I have for you today. If there's any questions, please let me know. We'll post these slides and these notes on our Aspire Medical Education Research website. It'll be under our Research Support Unit workshop folders, and then you'll see a folder for these materials. We'll open up that website as soon as we get some of our some items in terms of accessibility ironed out. But these pieces of information will be available to all of our audience members. Any questions, comments? Awesome work, everyone. We'll have our next workshop number 5 on methods and methodology. That'll be on October 30th. It'll be presented by Mr. Tofi Koch. So we'll hope to see you then, and we'll give you some flyers and reminders for the October 30th research opportunity or research workshop opportunity. Thank you very much, everyone. Have a good evening. Talk to you soon.